Hello, everyone. So, for our next topic is the medical indications for supplementary feeding. For the objectives, after completing this session, participants will be able to list the possible medical indications and reasons for supplementation, explain how to choose an appropriate supplement, discuss how to support mothers who have decided to feed their babies with infant formula, and describe the safe preparation of the supplementation. The World Health Organization and United Nations Children's Fund recommend infants be exclusively breastfed for the first 6 months of life. Although this is the goal for all children, sometimes supplements are medically indicated in certain cases. Supplementary feeding is done when we give additional fluids other than the mother's own milk provided to a breastfed infant before 6 months of age. These fluids may include donor human milk, infant formula, glucose water, or other breast milk substitutes. Giving newborns any foods or fluids other than mother's own milk interferes with establishing and continuing breastfeeding. As we have learned, newborn stomachs are small and easily filled. Newborns who are fed other foods or fluids will suckle less at the breast. This will interfere with stimulating the breast milk production and could result in breastfeeding failure due to the cycle of poor breast milk production and supplementation. Babies who are given supplementation before discharge from a facility are twice as likely to stop breastfeeding altogether in the first 6 weeks of life. Supplementation may also contain harmful bacteria and carry a risk of disease. Therefore, infants should only receive supplementation if there is a medical indication. These include low birth weight or less than 1,500 grams for preterms born before 32 weeks of age, hypoglycemia or low blood glucose levels which do not respond to breast milk, signs and symptoms indicating poor breast milk intake, high bilirubin associated with poor breast milk intake, and metabolic disorders. For low birth weight or preterm infants, LBW or preterm infants may require supplementation. These babies may be weak and tired easily at the breast. They may also lack the ability or the reflexes to swallow and suckle effectively. Supplementation may be necessary until they are able to feed at the breast. If possible, they should be encouraged to suckle at the breast. Full-term healthy babies do not develop hypoglycemia simply through underfeeding. Hypoglycemia is when there is low blood glucose level. Babies who are born prematurely or small for gestational age, who are ill or whose mothers are ill may develop hypoglycemia. If a healthy full-term breastfeeding baby develops signs of hypoglycemia, the baby should be investigated for another underlying problem. However, if an infant's blood sugar does not respond to breastfeeding or breast milk, they may require supplementation. Supplementary feeding is not needed to prevent low blood sugar in healthy term babies. Jaundice is common for babies, or the what we call the yellowish color of the skin in the first week of life. This is due to the high levels of bilirubin in the blood. The color is most easily seen in the white part of the eyes, and colostrum helps infant to pass the meconium, which removes excess bilirubin from the body. Babies who are jaundiced may need phototherapy because the mother's breast milk has not increased. However, a baby who has high bilirubin levels associated with poor breast milk intake may need supplementary feeding. If there is poor intake, the infant may require supplementation. However, they must be assessed to determine the cause of the poor breast milk intake. For maternal indications, delayed milk production with poor intake by the infant, if there is hormonal conditions, poor milk production due to breast pathology or breast surgery, if there is pain with breastfeeding unrelieved by other interventions, severe illness preventing a mother from caring for her infant, and if there is herpes simplex virus type 1 with open lesions. For HSV type 1, if a mother has HSV with open lesions on her breast or nipples, there should not be direct contact between the mother's breasts and the infant's mouth until the open lesions have healed. If it is only on one breast, the baby can feed from the unaffected side. For delayed milk production, as we have already learned in previous sessions, a mother's milk typically increases by day 3. Sometimes a mother's milk production may be delayed. If it is delayed by day 3 to 5 or later and the infant is showing signs of poor milk intake, the infant may need supplementary feeding. If there is also glandular conditions due to breast pathology or prior breast surgery, this may require supplementary feeding. A mother may have intolerable pain during breastfeeding that is unrelieved with other interventions. If positioning and attachment at the breast are correct, supplementation may be necessary until a cause or solution is found. If a mother may have a severe illness such as sepsis, preventing her from caring for her infant, and depending on the severity of her illness, she may be able to express breast milk for her infant. So for HSV, there should not be direct contact between the mother's breast and the infant's mouth until all the open lesions have healed. For special cases, it may include a mother being away from her baby for whatever reason or she may have died. Some maternal medications such as chemotherapy require a mother to temporarily stop breastfeeding during therapy. If a mother living with HIV will not exclusively breastfeed, this is an acceptable medical reason for breast milk substitutes. Supplementation should be performed in ways to preserve breastfeeding, including limiting the volume to what is necessary, stimulating the mother's breasts with hand expression or pumping, and allowing the infant to continue to practice at the breast. For breast milk insufficiency, if there is insufficient production, transfer in intake can be prevented and managed. If the challenge still persists, make sure the baby is adequately fed. Evaluate and consider the option of supplementation. For maternal preferences, for the mothers who have made a fully informed decision not to breastfeed exclusively or have chosen to mixed feed, may consider supplementary feeding. It is important to ensure that all mothers are informed about the risks and management of various feeding options and have been helped to decide what is suitable in their circumstances. All mothers have received factual information in a sensitive and respectful manner, including the importance of exclusive breastfeeding and basic management of breastfeeding related to their concerns. Practices that help avoid the need for supplementation can be prevented by implementing early skin-to-skin contact, which helps establish breastfeeding. Early and frequent breastfeeding, by delaying the time between the birth and initiation of breastfeeding, can lead to the need for supplementation, and rooming in so that responsive feeding can be practiced. So for options of supplementation, it could be donor's breast milk, formula such as ready to feed, concentrated and powdered. Formula may be cow's milk base, soy base, hypoallergenic, or we could also include human milk fortifiers. The guidelines for choosing a supplement. If there is expressed milk, if an infant requires extra feeding. However, if the mother's breast milk or colostrum does not meet the infant's needs, supplementation may be required. If supplementary feeding is indicated, donor breast milk should be the first choice of supplement if available. Some areas have milk banks where donor milk is available for infants who cannot be fed their mother's own milk or who need to be supplemented. The type of formula will depend on the needs of the infant. For low birth weight or preterm infants requiring specific formulas designed for their needs. Infants with certain metabolic disorders may require specialized formula in addition to breast milk. Glucose water is not an appropriate supplement since it does not provide adequate nutrition. Safe preparation and storage of supplements. The risk of illness is increased when supplements are handled or stored incorrectly. All equipment used for feeding infants and for preparing supplements need to be thoroughly cleaned and sterilized before use. Surfaces where supplements are prepared should be cleaned and disinfected, and the person preparing the feed should wash their hands with soap and water prior to preparation. If infant formula is to be used for infants at greatest risk, use a sterile, ready-to-feed liquid if possible. Its use may not always be possible and powdered infant formula may be required. Powdered breast milk substitutes are not sterile and can pose further risks to infants. Powdered infant formula requires hot water to be added. All water used for making infant formula needs to be brought to a full boil. Tap water and bottled water are not sterile and must be boiled before use. Powdered infant formula is also not sterile and must be mixed with hot water higher than 70 degrees Celsius to kill the bacteria. Cooled, unused commercial breast milk substitutes can be stored in a refrigerator for up to 24 hours at a temperature no higher than 5 degrees Celsius if prepared in advance. However, it is best to use powdered infant formula immediately as it provides ideal conditions for the growth of bacteria.